Good morning and welcome to the Health Hub. My name's Gary Borman. I am a qualified naturopath, nutritionist and herbalist, and I've been in clinical practice for well over a decade. So each week we're going to be bringing you a little bit of information on what's been in the news, some tips on keeping healthy, staying well, making you feel your absolute best. We might talk about supplements and anything else that might be topical in the news. Alrighty, to start the segment off, I do need to read a disclaimer to you. The following segment should be considered as information, education and potentially even entertainment only. It's not designed to replace professional individualised recommendations, nor does it infer ceasing prescription medications. If the information presented here does cause concerns about your current health regime, discuss these concerns with the prescribing clinician or a qualified healthcare practitioner in a proper clinical environment. So that does mean whoever prescribed the stuff, talk to them about it. If you have concerns, don't talk to your neighbour, don't talk to someone over the fence. And unfortunately, that doesn't mean going into the health food store and chatting about their thoughts as well. You need to have this proper clinical setting where diet, lifestyle, any drugs and potential interactions between food and drugs may go on. That's all about professional duty of care. So, that said, this week is brought to us by MyActive Joint Pain Relief. MyActive will be sponsoring the segment for a few weeks, and we'll touch a little bit more on what that product does as far as relieving the pain of osteoarthritis, because it's fantastic, works like nothing else. Been using it in clinic for a few years myself. Okay, so we're going to talk about the bushfire seasons, the long hot Aussie summer starting a little bit early. Avocados, are they good or are they bad? Give you a clue, it's pretty good. Latest in surgery and infection control, so anyone who might be undergoing some surgery coming up, this is some great news coming for stopping staph infections, antibiotic resistance, what it might mean to you, opioid epidemic and general painkillers, and the latest fad diet, the carnivore diet, and this gets the Darwin Awards, so pretty cool there. Alright, going straight into it, we've had a pretty mean start to the Australian summer. Here on the east coast we're burning. There is a lot of smoke, pollution and just general dust and stuff in the area. So much so that the air quality is so poor in places like Sydney, they're saying going outside for a day is like smoking 30 cigarettes or more. Now this sort of air quality is absolutely terrible. And the thing that we know with smokers in particular, they tend to be about 40% lower in vitamin C content than the average person. So I would highly recommend that anyone who is in these places where they're getting a lot of smoke and dust and general extraordinary amounts of pollution, start looking at taking an extra vitamin C. Now whether that be tablets or powders, I always think powders are much better, but tablets will get you there. So a tablet a couple of times a day is going to work much better than just taking it all at once, and that's going to help keep your vitamin C content up and help as a general antioxidant when your body's under a lot more stress because of the poor air quality. Also, stop watching TV, turn it off, walk away, because the amount of doom and gloom that we are seeing is having impacts on people, in particular children. They can get quite stressed by this and actually having effects on their mental health. If you do know someone who has unfortunately been in one of the crises, lost their home, lost property, or even their pets, get them to talk to a proper counsellor. So someone who specialises in PTSD would be my recommendation, and help them get through that. So heart goes out. Hopefully we see the end of this very, very soon. We might get a little bit of rain, that'd be nice. Wash my grass, be handy. Okay, into the first of the stories. Avocado, is it good or is it bad? So there was an article recently in a weekly publication, B+S is what it likes to be known as. Let's just take the plus out of it because I think it's pretty well BS. Yeah, there's some low quality stuff that comes out of that. And why I say that will become obvious. The article was about how healthier foods might not be as healthy as you actually think. So they actually said avocado is not this really healthy food that they're made out to be. And they said with the amount of energy that's in an avocado, it's very similar to what is in a Mars bar. Now Mars bars, yeah, they're great for work, rest and play, but they are pretty well just sugar and a lot of good times. Whereas an avocado, there's some fibre in there, there's lots of really good oils, and it's pretty hard to say anything too bad about them. Some people do have sensitivities, you know, they are a bit of a high salicylate food, but other than that, I recommend them to just about everybody, and I think they're a fantastic food. Now, in the article, it did go on to say that bread. Bread is actually a health food. So they said it's healthy. Well, not in my universe, I'm afraid. I've been in practice for well over a decade, and we've done hundreds of sensitivity tests. And one of the most common things is everyone comes back sensitive to breads. The wheat that is used is very highly refined. There's a lot of yeast in there. There's a lot of preservatives in there. And really, with all that concoction going on, the last thing you could call it is healthy. If you wanted to go out there on a limb, you could look at some of the hot bread kitchens, for instance. They make preservative-free breads. And, you know, there's not as much junk in there. But in southeast Queensland, in summer, 2 or 3 days later, it's going to start growing hair and growing mouldy. Whereas a lot of the other stuff, you know, there's fast food chains out there, their buns, they're looking the same 2 or 3 years later, and there's some, I think, have even cracked 10 years. So that is still in that bread category, so I'm afraid that will never get called healthy in this clinic. The other things I were talking about is a tablespoon of peanut butter. Well, peanut butter in itself isn't that bad a food. You know, plenty of protein in there, some good oils. Unfortunately, peanut allergy is absolutely rife. Australia per capita is one of the highest for allergies in the world, and peanut allergy is the thing that most kids are first detected with. I know when we go back to my early schooling days, there would have been 1 or 2 kids in the whole school that had allergies, whereas now just about every classroom has an EpiPen, and there are certainly plenty of schools around where you aren't even allowed to take nuts of any sort into the school, let alone peanuts. So, you know, almonds, etc. are all banned. So let's just say peanut butter, probably not the healthiest option in there if you are looking for something that's got a little bit of good oils and some protein. Finally, they recommended to go easy on the olive oil. Now, I cannot for the life of me think of why anyone would say that. Olive oil is extremely healthy. Repeated studies come back at how good it is. Just get yourself a good extra virgin, use it cold, don't heat it, and you just can't go wrong. Tip it on everything. Tip it in your salad, tip it in your vegetables. So let's just say BS, we're just going to have to disagree on the quality of your article there. Irony does strike, you know, because in the same week, there was an article that was published in the Journal for Molecular Nutrition and Food Research. Now, that sounds much more impressive than BS. What they actually talked about is all the benefits of avocados that they've recently discovered. Apparently, they will help with your digestive system, alleviate depression. Didn't even know that one myself. That's pretty good. Strengthening your vision and reducing your risk of osteoporosis, as well as healthy cholesterol regulation. So that all sounds like pretty good stuff, not a food that we should be avoiding in preference to a Mars bar. They have found a particular molecule only in avocados called avocation B, or AvoB for short and easier pronunciation, especially after a beer or two, can actually help incomplete oxidation in skeletal muscle, which causes the pancreas to reduce insulin resistance. And that all sounds really good in nerd terms. And that is really good stuff, because insulin resistance is the first stage of type 2 diabetes. And that's where the body is just not managing the blood sugars well. You keep producing more and more insulin, and the body's just not responding so well to it. So that's actually a fantastic tick in the box for avocados. When there is the elevated amounts of blood sugars, it increases your risk of heart disease, stroke, kidney disease, etc. So all the bad stuff. They also went on to say that normal fatty acid oxidation helps burn fats, which can help manage weight as well. So avocados just ticks all those boxes for me. And to make this actually a good piece of research, they actually tested in humans as well as in mice. So we see a lot of tests that are done in mice or rats, and they say, therefore this extrapolates to humans. Well, mice and rats can gnaw through gyprock walls and chew on timber and eat plastic wires, and it doesn't seem to bother them too much. Whereas us humans, we really don't do well on that sort of stuff. So I find it very difficult to extrapolate that rodent studies will be the same as in humans. So kudos to these guys. They actually did the study in some mice, then they did the study again in humans, and they got the same results. So absolutely fantastic. Go crazy with the avocados. Enjoy them. BNS, or B plus S, is BS. That's what I think of their journalistic integrity and quality. Alright, infection control and surgery. This was actually some really cool stuff that's come out recently. We all know about golden staph running rampant through hospitals and the problems that it can cause. You know, that infection gets into the tissue and sometimes you can come out unhealthier than when you actually went in for the surgery. Well, what they've been finding is that Manuka honey is extremely effective on treating golden staph. And when we had procedures involving mesh, so like the mesh repairs for hiatus hernia in particular, the bacteria use this mesh as a superhighway for infecting up. But what some scientists have come up with is a way of bonding some Manuka honey into these meshes and making them antibacterial and being able to perform the mesh repair. So really, really clever, because hiatus hernia is one of those things, it just isn't going to fix itself. The stomach slides through this piece of tissue, usually the diaphragm, and a lot of people get some really unhappy digestive symptoms from it. You know, a lot of reflux, and they get on proton pump inhibitors, and all that is managing the symptoms. So if this can be embraced a lot more into modern surgery, these mesh repairs can come back and we can see people not struggling with their hiatus hernias anymore. So kudos, great stuff, very simple idea that has gone into surgery. So this one doesn't get screwed up, great stuff. Where are we going? Antibiotic resistance and what it means to you. Well, what we've been seeing over the last 20 years is a massive rise in the amount of antibacterial resistance. So where simple drugs like amoxicillin would have been effective, we're now going into some of the ones that were last resort drugs being used first up. And really a week doesn't go by while they're not commenting, or World Health isn't saying we've got to get on top of this, we either need new classes of antibiotics or we've got to stop using antibiotics as much. What a lot of people don't know is that the majority of the antibiotics, something like 70 to 80%, is actually used in livestock. So in chicken compact feedlots, as well as with piggeries and with cattle. And they routinely just give these animals antibiotics, A, to help fatten them up, and B, just so that they don't get sick, because if some sort of bacteria goes through the colony, that can wipe out, 1,000 hens or potentially a couple of hundred head of cattle. And where this has become a bit of a problem is because we're using these things so routinely, bacteria mutate very, very fast. And there was a fantastic study done by Harvard Medical a couple of years ago, and you can find it on YouTube, where they took this great big jumbo-sized agar plate. So it was 2 feet by 4 feet in the American terms, which for the rest of the world means 60 by about 120 centimetres. They divided this into 9 sections, and they were sectioned off going into the middle. So they started at 0 amount of antibiotic, single dose, 10 strength, 100 strength, 1,000 strength. And what they did, they used E. coli, which is a very common infectious agent, poo. So food poisoning, a lot of it gets involved there. And over the course of only 11 days, these bacteria managed to become resistant into the 1,000 times of a normal dose. And 1,000 times a regular dose is going to kill us humans. Not a hope in hell have we got of surviving that. But in only 11 days, these guys were able to survive it. So if you do get bored, watch that video and you just watch it come through. As they march through, on average it was about every 3.5 days they moved to a new segment. So in 3.5 days, yep, they filled the whole section up that had no antibiotics. Then a couple of colonies started out and you saw them fill in the 1 by strength. And then a little bit later, a couple of colonies started, and then within a couple of days filled in the 10 by, the 100, and then into that 1,000. So this is a great example of just how fast these bacteria can mutate and why we need to keep the use of antibiotics to an absolute minimum and only where they're required. So simple stuff like better infection control makes a lot of sense, and don't take an antibiotic if you've got a virus. They're absolutely useless. For general stuff, using first aid, things like colloidal silver, even honeys on our skin, iodine is still a very effective antibacterial, as well as 70% alcohol in some of those alco swabs. Just checking the time, 15 minutes in, we've got plenty of time. Alrighty, as I said, this week's segment is brought to us by MyActive. Now, MyActive is the latest in joint pain relief. Something I've been using in my clinic now for around about 3 years, and really the results are nothing short of astounding. It's been made and designed like nothing else in the marketplace, which is why it works so well, I believe. And when I say it's made totally different, it's because there has been a mixture of various nutrients that are required by the cartilage or the joint to repair itself. So it's not just a glucosamine, it's not just a fish oil, it's not just a single thing like so many other approaches have been just to try and manage some pain. So it's had that synergistic approach, and for the people that are on it, we're finding they've been in pain for years and they've become pain-free in only a couple of months. Or some people who've used drugs I really struggle to pronounce, they've been able to reduce the amount of drugs they use and still get more pain relief. So absolutely sensational. MyActiv isn't available in stores, it's only available online, miactiv.com.au, and look, really you've got nothing to lose. It is as safe as any drug can ever be. Indeed, the amount of toxicity, you could eat an entire bottle of this stuff and it is still well within the lethal dose ranges, so you won't even hurt yourself. So myactiv.com.au, do yourself a favour. Right, moving into the next area, it's a good segue, is what they call in the opioid crisis. This term has been used a lot around the world, especially in the Western world with Australia and America, where we're just taking so many of these prescription painkillers, and they're hardcore painkillers too, that people are getting addicted to them, and lots of people are dying from them. And when I say lots, I mean thousands of people are dying from these things routinely every single year, and the medical profession is now saying we've got a real problem here with the amount of people that get hooked on them because they just keep using them more and more and more, and the associated death toll that has been coming with that. And a post I put up in the Feeling Great Naturally area very recently actually was about the amount of scripts for opiates. There were 3.1 million scripts written in Australia in a single year, and that equated to about 715,000 filled prescriptions. So I've interpreted that as repeat prescriptions. And yet the amount of heroin users, so same class of drug, just not the legal sort, was only 40,000. So nearly a 20-fold increase in people taking legal heroin or a derivative of it. So I think you'd agree this is a real problem that we've got to look into and reduce the amount of painkillers we're reaching for. But what we do need to be aware of is what alternatives we're putting into ourselves. And we'll talk more about this over the coming weeks. But for this week, product ibuprofen, we all know of it. It's got a couple of trade names in Australia. I probably shouldn't say them out loud, but they're known as, and the other one is. So if you can lip read good on you, you know what I'm talking about, but I didn't say those words out loud. Now, what I've done, I've just stripped a printout from the MIMS. Now, the MIMS is all the drugs that you can get in Australia. And it talks about some of the adverse effects of this simple chemical ibuprofen. And remember, you can buy this in a supermarket. Go to Coles, Woolworths, IGA, 7-Elevens, take your pick. You can buy these over the counter, no one's going to query you about it. You have to be careful because of asthma, hypertension, because it can potentially increase your blood pressure. Prolonged use can increase the risk of heart attack and stroke. Not a good thing there. Can cause liver impairment. Warning on anyone over 65 years of age, pregnancy in the first or second trimester, and children under the age of 12 years old. Checking my time, 11 minutes to go. Adverse reactions, and this is not all of them, this is just a couple. Gastrointestinal bleeds and gastrointestinal perforations. Now that's bad stuff. We can get shortness of breath, anaphylaxis. That's that, think, you know, EpiPen required, stick it in because your throat's swelling up, your eyes are bulging out. Very, very bad. And it says hypertension, so increasing blood pressure, swelling, cardiac failure, and others. They say don't take it if you're over the age of 65 because of the potential for interactions with other drugs. And do not give to children under the age of 12. It does also interfere with the INR, or International Normalised Ratio. Anyone who's on blood thinners will be aware of this. That's why they're always monitoring it, making sure that you don't bleed too profusely. So yes, they say it may increase the risk of severe bleeding, their words not mine, and sometimes fatal hemorrhage, especially from the gastrointestinal tract. This is the sort of thing they normally bag aspirin about. So I think it's probably not the greatest drug in the world. So yeah, I'm afraid you're with the BS stuff then. Alright, now the Darwin Award for the week. This is a new diet, let's call it a fad. It's called the carnivore diet. It is meat only. And it has been made famous by someone called Sean Baker, a US military trauma surgeon who is not using the title doctor. Very interesting. Why wouldn't he use that? Don't know. They seem to like that title. He seems to be the driving force behind this diet. And he claims he eats up to 2.7 kilograms, 6 pounds because he's an American, of red meat every single day since early 2017. Now, to put that into perspective, any of those who are watching might have been to the Breakfast Creek Hotel, had one of those fantastic big 400-gram steaks. Now, they're not bad, and they do take some getting through, I'll give you the tip. So you're normally not even having lunch just so that you can save up and enjoy that steak. Well, this guy, he's having 6-ish of those a day, 2.8 kilos, that's 7 of them. So let's just round it down. 6 Breakfast Creek 400-gram steaks a day. Oh my God. That is an amazing amount of food. I don't know anyone who can eat that. And I've seen some people consume fair amounts of food, but nothing like that. However, he goes on to say it made his joint pains go away, improved his sleep, normalised his libido, whatever that means, but it gave him the libido of a 20-year-old, and yet this guy is in his 50s. So, don't know who said he's got the libido of a 20-year-old, possibly him, because he is quite the social media poster, this man. Over 700,000 posts in a couple of sorts of social media in only 3 years, so early 2017 into 2019. Wow, so the diet must be good, just asking because he's telling everybody about it. There are other influencers out there, someone called the outspoken Canadian psychologist Jordan Peterson. So Gordon Peterson, psychologist, clearly not nutritionist, who adopted the meat-only diet thanks to his daughter. They go on to say that neither of them have recommended this diet to anybody else, but they are doing so well on it. So keep figuring that one out, I wonder why. There was also an Aussie who got on it and said he felt clearer, had less joint pains, etc. Well, good on you. I think you people must be what we call outliers. Now, there are they could be out and out liars too. But what we call outliers, remember the bell curve at high school, the 4s, the 3s, the 5s, the 7s and 1s. So this 1%, I think these are probably like 0.1 or 1%, that having a diet like this they can actually feel good on. Because I've run this past a few other people and they've just done the big oh my God as well. That much red meat sitting in your gut is just going to putrefy. It is not going to do you any favours. Your bowels are going to revolt and they're going to hate you, and it's not going to take much time. I'm surprised that Mr. Baker has lasted nearly 3 years personally. I can't see how this is a well-rounded, nutritionally balanced diet either. Like, red meat has what is in red meat. So you might do alright with some iron. Very bad if you've got hemochromatosis, so it would be a shocker for you. Vitamin C, there's none of that in there. Pretty well none of your water-soluble vitamins, to be blunt. You will pick up some B12, fair amount of that, but no folate. B12, folate, they need to be kept in a balance for correct methylation, and that's pretty important for a lot of reactions that go on in the body. B9, folate, foliage from the Latin, plants. There is no plants in red meat, unfortunately. So again, I really can't see how digestive health could go on with this, because our gut flora likes eating the byproduct of vegetables, so fibre. And when there's none, there is none. So again, I can't see where magnesium would come into this. I can't see the vitamin C. Most of the B group vitamins. Wow. It's also very acid forming. When we digest food, it basically burns to an alkaline or an acidic residue. Where there is acidity, there is pain. And when there is a lot of acidity in joints, we have a lot of joint pain, and that leads to arthritis. So for this one, I can't see how their pains have gone away. I can't see how it will be good for the vast majority of people. But for those, if they're doing it and they're enjoying it, look, that's fine, more power to them. And that's pretty well another one. Don't do it, I don't think it's any good for you. Well, as the clock ticks down, we're at 25 minutes, so that will bring this week to a close. Look, thank you very much for listening in. Do appreciate that. Hopefully you might have learned a little bit, you might have been a little bit entertained, and or both. We'll be back every single week to try and pass on some good advice and keep it in nice light-hearted manner, so it's easy to absorb that sort of stuff. I know science gets pretty boring unless you're a bit of a nerd like me. But what I would recommend, if you do have any questions, come and see me in a professional consultation. I practice in a private clinic, so it's a house-based clinic in Cleveland, and that way we can go through any concerns you have and give you advice that is specific for you, your diet, your lifestyle, and any prescription medications you might take. So again, thank you very much, and until next week, be kind to a stranger, because one time you might be that stranger and you'd like someone to be really kind to you. Until next week, thanks for watching.